Welcome. In the next few minutes, I will take you on a brief tour of Central European healthcare systems. I have selected a couple of data which I hope you will find interesting and relevant. Let's start with a general overview about this region, which we sometimes think is so homogeneous. Actually, it's not quite true. There are 11 Central European countries which are members of the European Union, and they have a combined population of approximately 100 million people. By far the largest of them is Poland with 38.5 million people, followed by Romania with almost 20 million inhabitants. All other countries have populations of 10 million or fewer. There are indeed many commonalities among these countries. All their healthcare systems are based on social insurance. They are facing financial constraints or have budget-focused decision-making. And the institutions responsible for healthcare change quite often in these countries. It's a popular pastime in Central Europe to count health ministers. Hungary, for example, ate up 15 health ministers in 25 years. This means less than 2 years in office for each of them. This unpredictability certainly doesn't help the implementation of longer-term health policies. But there are many differences between these countries too. Economic development is very different from the Baltics to the Balkans. Per capita GDP, for example, ranges between 7 and 21,000 US dollars. It's a threefold difference. By most metrics, Czech Republic, Slovenia, Slovakia, and the Baltic states are the richest, while Bulgaria and Romania are, so to say, the poorest. Central European EU member states. Besides economic development, social development is also very different across these countries, and this is reflected in other factors such as health consciousness, citizen involvement, and the quality of health policies. Slovakia and Czech Republic merit a special mention for just one single reason. These are the only two countries in Central Europe which tried the implementation of a multi-insurer type of system, so there is no single one health insurer in these countries, but rather there are more health insurance companies. Now, let's focus a second on GDP growth in the larger Central European EU member states. Take a look at this chart. It shows that per capita GDP has been following a moderate growth trend in most countries, although the trend was temporarily interrupted by the financial crisis in 2011 and 2012. At the top of this chart, you can also see the evolution of the average EU per capita GDP. This is still much higher, and Central Europe has still a long way to go to catch up with the European Union average. And now, let's jump to the interesting part. You can see a lot of columns here, but don't get scared. These columns show healthcare expenditure as a percentage of GDP for 6 Central European countries: Slovakia, Czech Republic, Hungary, Poland, Bulgaria, and Romania. You can also find here on the right the Central European average and the European Union average. You will have noticed that healthcare expenditure as a share of GDP has been decreasing in all the countries shown in this chart, except for Bulgaria, where healthcare expenditure seems to have followed or even slightly exceeded economic growth. Now look at the green parts down there of the columns. These show that part of healthcare expenditure which is paid by governments and public bodies. This is called public healthcare expenditure. You can also see that public healthcare expenditure constitutes most of healthcare expenditure in the region. This is certainly positive. On the other hand, the blue parts up there are quite significant too. This may refer to high co-payments in some Central European countries, or it may show that some services which people regularly use are not publicly funded in the region. You will also have noted that public healthcare expenditure has not followed the GDP growth either. This reflects the fact that governments in Central Europe do not prioritize healthcare investments on the political agenda. Finally, look at the right of the chart. The arrow illustrates the difference between the Central European average and the average of the whole European Union. There seems to be an approximately 2% difference in the share of healthcare expenditures from GDP. If you remember that healthcare investments correlate with better outcomes, this 2% difference may account for part of the health loss that Central Europe has experienced. Let's have a closer look now at pharmaceuticals and especially at public expenditure on pharmaceuticals. You may be aware that the list prices of medicines and the net prices of medicines are often significantly different in Central Europe because pharmaceutical companies offer large discounts and rebates. This is why we must consider net public pharmaceutical expenditure, where we want to compare how much Central European governments spend on medicines. This chart shows an analysis of net public pharmaceutical expenditure, that is the money which governments effectively allocate to purchasing medicines for society. You can see quite a challenging situation here. Those countries which have tended to invest into healthcare, yes, and especially pharmaceutical care, have in fact executed restrictions. For example, Hungary, shown in grey, carried out a heavy cost-cutting program in 2011. Slovakia and Czech Republic have traditionally provided above-average access to medicines, but as of 2017, significant changes have been decided in pharmaceutical policies. As regarding Poland, this country is currently the most restrictive environment for medicines in Europe. Polish citizens have practically the lowest chances of accessing innovative medicines, not only in Central Europe, but in the whole European Union in general. Well, how can we sum up? Everything is relative. If we compare Central European EU member states with countries outside the European Union, the picture about healthcare expenditures may certainly be positive. However, if we compare healthcare expenditures in this region with the whole European Union, or if we look at the trends of decreasing investment into healthcare in Central Europe, then the picture is actually quite bleak. Accepting that health and well-being are social goods, a lot more should be invested by Central European governments to catch up, at least with the European average. Well, thank you very much for your attention, and I hope that you have found this presentation useful.